symptoms of the brain, psychiatric symptoms is what they fall under that category. In 1998, I started hallucinating and having major problems. As a registered nurse, I guess I kind of knew that there were all these really bad symptoms that could go with lupus, including kidney failure and organ involvement, but I never even knew it affected the brain.
Hematologic disorder, which presents itself by an abnormally low red cell, white cell, or platelet count. Immunologic disorder, which means antibodies are present to DNA, the SM antigen, or phospholipid. This could include a false positive test for syphilis, or anti-nuclear antibody, an abnormal level of an antibody directed at the nucleus of normal cells found by fluorescent, FANA, or other testing, and in the absence of drugs known to be associated with drug-induced lupus syndrome.
What's important to remember is that while we like there to be 4 criteria present, we often make a diagnosis when only 2 or 3 of these criteria are actually present.
You have to sort of take everything into consideration. The person's age, what's happening to them, what they exactly have, and does it all add up?
Some people with lupus may experience painful, stiff, or swollen joints, sensitivity to sunlight, hair loss, long-term extreme fatigue, unexplained seizures, mental confusion, nose, mouth, or vaginal sores, or a persistent fever. Others may feel a sharp chest pain after a deep breath, or notice their fingers that turn white or blue in cold weather. Symptoms vary considerably from patient to patient.
I've never seen 2 lupus patients who are the same, and it's only by hammering people into little categories that you can say they all have lupus.
Before the diagnosis is made, the patient and the patient's family and friends may become very frustrated. Feelings of doubt, fears of being a hypochondriac, and ongoing fatigue can make the patient feel depressed and hopeless. Unfortunately, this seems to be very common with lupus sufferers, and there can often be a sense of relief when the diagnosis is finally made.
I went to different doctors, different specialists, and it was like for 9 months, and finally they decided to do some tests on me. They discovered that I have lupus. So in the beginning I was very relieved because I finally had like a diagnosis. Something was happening to me. It was not in my imagination.
Lupus patients are always subject to new symptoms, ongoing doctor's visits and lab tests, and enduring the side effects from a variety of medications. Systemic lupus can eventually go into remission, but it is much more common to be in control through the use of medications. Flares of lupus can occur because of environmental triggers, such as infection, illness, surgery, pregnancy, ultraviolet light, extreme stress, or sometimes from antibiotics. Because lupus affects so many different organs and systems, the symptoms vary widely.
My kidneys were affected by lupus, and that was very serious condition for me to be in, and right away I was on prednisone to control lupus.
I just started feeling the flu and I was really tired, and I also noticed that I had arthritic symptoms such as pain in the joints.
The treatments for lupus have changed through the years.
Well, this is a very exciting time for us, for those of us who treat patients with lupus. On the horizon are things like biological agents which target the faulty part of the immune system while sparing healthy cells. The other things that are being explored are things like stem cell transplants, and hopefully with all of the information we're gathering at this time, we will be able to treat lupus much more effectively down the road. Plaquenil, which is also known as hydroxychloroquine, is commonly employed to treat arthritis and skin rashes, and it also works well for fatigue. It is generally considered to be a safe medication. It's been on the market since the 1950s, but we do encourage patients to closely follow up with their ophthalmologists, and at a minimum of once a year.
A fact that is worth mentioning is that Plaquenil has a beneficial side effect of lowering cholesterol levels.
Medications that we usually use for arthritis and psoriasis can include aspirin and anti-inflammatories. At times we will also use steroids. The drugs can be very effective, but we do caution our patients to take the medications with food to reduce the chance for stomach upset and stomach ulcers.
When lupus affects the organs, such as the kidney, heart, lungs, brain, or blood, The doctor may choose to use corticosteroids, such as prednisone. These are powerful anti-inflammatory drugs. These drugs can be topical, applied to the skin, oral, or intravenous.
We caution our patients to closely monitor themselves for side effects, which can include things like weight gain, puffiness of the face, cataracts, bone thinning, and sometimes even change in mood and insomnia. We encourage our patients to continue to exercise and carefully monitor their caloric intake, in addition to limiting things like sugars and fats. And we also tell them to supplement with calcium and vitamin D to replace the nutrients that they lose when they're taking steroids.
It made me so uncomfortable, gaining all that weight, going from a skinny girl to a, overweight and puffy, with a moon face.
So I decided to go to a nutritionist, and she made a special diet for me. So this is the first change I had to do.
Cutting back on the red meat has helped me lose some weight that I've gained from prednisone, for example, from a medication that I take.
Sometimes more aggressive treatments are prescribed for lupus. In the most severe cases, chemotherapy agents are prescribed, sometimes in conjunction with intravenous steroids. This treatment is very powerful in suppressing the immune system.
Since I had the kidney involvement, they felt that taking Cytoxan or chemotherapy was the best action to take to get me back on my feet and to try and put the lupus in remission.
Kidney problems are common in lupus patients. Most of the time, these problems are mild and can be treated with medication. But when the kidney is more severely affected, chemotherapy, dialysis, or a transplant might become necessary.
We employ chemotherapies when patients have serious internal organ involvement. An example of this would be brain involvement or kidney involvement. And when chemotherapy is employed, we're also often using high doses of intravenous steroids. The most commonly employed chemotherapy is known as Cytoxan or cyclophosphamide, and our patients have to be monitored extremely closely when this medication is administered to be certain that their bone marrow is responding appropriately. They're also monitored for things like infections, and so they're seeing their physician and having laboratory tests done quite frequently.
There are some exciting prospects for new treatment methods and hopes of eventually finding a cure for lupus.
There have been wonderful studies lately that have helped us to understand the immune system, and I think that this will lead us in the direction of finding a cure for lupus.
Alternative medicine can play a part in the treatment of lupus with the supervision of a doctor.
We're very careful when we advise our patients on the use of alternative treatments. Safe avenues to explore are things like acupuncture, massage therapy, and water therapy.
Echinacea, alfalfa, some of these things are not good ideas for people with lupus. And in general, I tell people to avoid the herbal medicines simply because you don't know what exactly they have in them.
My lupus has improved because I've been going to acupuncture, in a sense that it's given me more energy.
I find that alternative therapies work, acupressure, acupuncture, and Tai Chi. I find that it's really helpful in the processing of stress.
There was a time when lupus patients were advised that they could not become pregnant, but this is not necessarily true today. The largest risk is spontaneous abortions, miscarriage, or premature birth. But over 50% of lupus patients experience completely normal pregnancies.
I was lucky to have a very easy pregnancy. The concern was that I might have a flare-up of lupus during pregnancy, and the other concern was if I would have a full-term pregnancy, which I again did. I delivered at 9 months, a healthy little boy, and I must say very energetic.
I had 3 doctors who managed my pregnancy. It was my rheumatologist, my gynecologist, and my neonatologist. It is necessary for a woman who had lupus to have these doctors who